Thank you everybody for joining us today. My name's Graham Folds and I'm the Regional Director for Laerdal Asia Pacific and the Managing Director for Laerdal Australia and New Zealand. Today I'll be your moderator for this webinar. Today we're privileged to have our speaker, Dr. Paul Phrampus. Paul is well known to many people across the Asia Pacific region. He's a leading expert in simulation and patient safety. During this webinar, Paul will be sharing the importance of simulation as an educational tool for the healthcare workforce. Now, please, ladies and gentlemen, join me in welcoming Dr. Paul Phrampus. Welcome, Paul.
Thank you very much, Graham. I appreciate being here and look forward to participating in this Sun webinar, and I look forward to when we can be face-to-face again. So thanks again for the invitation. Many of you are probably aware of patient safety issues in the country that you come from. You may have heard from international news and so on. This is a global problem. There's no doubt about it. A couple years ago, there was a study done, and I think this got a lot of global press in terms of the patient safety issues in the United States, where the researchers declared that the third leading cause of death in the United States was from medical errors. That study underwent a lot of scrutiny in terms of whether it actually is that high or not. But the bottom line is, I think in that study, they were estimating around 250,000. Another study came up and said about 400,000 people die annually in the United States from medical errors. And I always say that whether we're off an order of magnitude, 10 times or not, there's far, far too many people that are harmed by medical care. So let's shift gears here and talk a little bit about patient safety. I want to start with asking, what's the goal of patient safety? Reducing unexpected patient harm that occurs during the delivery of healthcare. Patients and their families come to us. They really believe that we're going to take the best care of them possible, and we do as well. But many, many times, as I outlined back in my slides with the scope, we let them down. And harm comes to the patient simply because they were seeking out healthcare. So patient safety is trying to evaluate how do we systematically reduce the chances of harm coming to patients just because they showed up to get their care. No talk on patient safety would be complete without looking at the Swiss cheese model of patient safety and how it factors into healthcare. If you look at this slide, there's always harm heading towards the patient. And the Swiss cheese model basically describes how each thing that we put in place from a patient safety perspective is designed to stop that arrow from eventually hitting the patient down here. So the more slices that we put into place, the more likely we are to stop the harm from actually hitting the patient. The problem we have in simulation is everybody thinks of simulation here as a training tool only. And I think that we need to broaden it a little bit and make people understand that simulation is a great surveillance system. Simulation plays a great role in the procuring, deployment, and continuing education surrounded by equipment. Simulation can help with some policies, and I'll talk about that in a few minutes. Simulation can investigate staffing and the ideal roles and goals that people play in routine care, the ideal roles and goals people play in emergency care, and so on. So there's lots of possibilities for simulation for the future. My point is, when we are trying to systematically implement simulation deeply into the hospital, we have to align our goals, objectives, and our return on investment package with the problems that are vexing to that particular hospital. Polling suggests that only about a third meet with the chief safety officer or the people in charge of safety in a given time frame. I said twice per year. If we're going to partner in patient safety, we want a simulation leader at that table in that conversation on the monthly basis at a minimum to provide this. So I think it's really important. When I travel around the world and talk to people in person, it's very interesting that I find that a lot of people don't even know the name of the patient safety officer or the chief quality officer of their institution. So that's how far disconnected sometimes simulation programs can be. For more on this topic or anything involving healthcare simulation, please subscribe to our YouTube channel or visit our website at www.wiser.pitt.edu.